Good morning and welcome to our Deepening Well-Being and Equanimity during the age of COVID-19. I'm Arlene McAtee. I'm co-director of the Partnership's CARES project, a project with the goal of supporting the Community Action Network in its work during the unusual time we're facing, and in helping to share the lessons learned regarding resilience in the midst of challenge. You will meet Lana Shope, who you see on your screen now, our other co-director, at the end of this presentation. A few quick technical notes before we get started. This webinar will be recorded and made available to you all through both a follow-up email and on the partnership website within 2 days. Please note that you will be muted for this presentation, but you should be able to hear us out of your computer speakers. If you lose audio at any time during the presentation, please click the Communicate tab in the upper left-hand corner of your screen and select Audio Broadcast to reboot your audio. If you continue to have audio issues, you can also call into the session using the teleconference number located at the bottom of your confirmation email. You can send any technical questions that you may have to the host in the Q&A box. And please feel free to send any content-related questions that you have for our presenter in through the chat box throughout the duration of the presentation. Also, please be sure to select all panelists from the Send to drop-down menu before sending your question. If you get disconnected and need to contact anyone, please contact the host. Good morning, everyone. The CARES project and this presentation tie in perfectly with the promise of community action. Community action, as our promise states, changes people's lives, embodies the spirit of hope, improves communities, and makes America a better place to live. We care about the entire community and are dedicated to helping people help themselves and each other. In the spirit of that promise, it is my honor to introduce our trainer, Dr. Denise Shervington. Dr. Shervington has had an intersectional career in psychiatry and public health. She is a clinical professor of psychiatry at Tulane University School of Medicine and the president and CEO of the Institute of Women and Ethnic Studies, a community-based translational public health institute. At the Institute, Dr. Shervington directs a federally funded trauma-informed teenage pregnancy prevention program, as well as the community-based post-disaster mental health recovery division that she created after Hurricane Katrina. At Tulane, Dr. Shervington provides psychotherapy supervision for psychiatry residents. She has an illustrious career in public mental health and population health, with posts at the national, state, and local level. She also has an extensive clinical and community expertise in post-traumatic stress disorder and trauma-informed response. She has provided us with wisdom and skill building in the past and has had some of the largest audiences of any partnership webinars. We are appreciative of her working with us at this time and getting us into her very full schedule. And now, Dr. Shervington will share Deepening Well-Being and Equanimity during the age of COVID-19. Welcome, Dr. Shervington.
Thank you. It is an honor to be invited back. It's an honor to be with you. And if there are any folks in the audience who are returning, you probably will hear. Some of this will be a repeat. I was reflecting, when I first started in March, we thought this was about 2 to 3 months at most, and then we'd be back to normal. But we're not. And given that the only way we're going to make through and be okay is to accept the reality as it is, then here we are with presence. And so I am going to go through some slides, offer some, hopefully, knowledge to help you make it through this period. We are all responsible for each other. This is not, even though eventually I will end on things that we individually can do, the only way we're going to make it through this pandemic in the best way is if we sense our responsibility and the collectivity that each one of us has to care for each other. This is no longer about individual freedom and rights. As a Native woman I heard said, this is about our responsibility to each other. So as a society, at the federal level, we need the policies, we need the action, we need the leadership. In our communities, we also need that to happen for us. And at core, each individual doing the best that they can do to stay safe and protected, and I'm going to also add, and stay sane. So this will be the focus of my conversation today. I hope that it is a conversation, and that at the end, when there's an opportunity for us to interact, please light up the chat box. So here we go. We're in the age of COVID. As I said, when we went on lockdown in March, most of us thought 2-3 months at most. It's now December. But I know that if we do the right things for ourselves and each other, we can make it through as best that it can be done. For some of us in certain communities, and hopefully all of us, we also experienced in May 8 minutes and 46 seconds of brutality. This has been with us for a long time, and sometimes disasters give an opportunity to start fresh. So hopefully for those of you who are doing work on anti-Blackness and on equity, we can all see our responsibility to do the best we can to respect each other's humanity, regardless of any isms or divisions that we artificially put forth. This is a time where the big questions, for some people, they're not so big because they think about them all the time. But for most of us, in our ordinary lives, we forget that there's at least 4 things that all human beings have to manage. And so I'm going to be slower. I invite some chat if you want to, because I'm going to ask you to reflect as I go through these issues, that especially when we sense that there's a threat to our survival, these are some issues that are underlying our experience as human beings, and things that hopefully every now and then we think about. And so I'm going to, when we think, we all have to deal with the issue of freedom. What does that mean? We know our life is boundless, even though we are so socially connected. However, the boundaries around our freedom to be responsible for ourselves, to create our own life stories, again, hopefully within the collectivity that moves us as a society towards good. So I'd like for you to just think about and ponder, how do you make choices about how to live your life? Just ask you to reflect, just a mental note. what does freedom mean to you, and how do you make those choices? Another issue that we all must deal with is the reality of our isolation within our experience of our consciousness. Even if we were part of a multiple birth, we're still the only ones experiencing the consciousness within the biology of how we're made. So we were thrown into the world alone, and we're going to die alone within that experience of ourselves. Only you can experience what your conscious being is. So as a result of that, I would like for you to just reflect, make a mental note, and for those of you who have a scratch pad and would like to write a word or two, do you try to fuse and cling to others because of your fear of this isolation, because of experiencing this isolation as loneliness? We know that we have a public health crisis in this country around people feeling lonely. Or can we take this as an opportunity to see solitude and the beauty that comes from spending time in our inner life? So think about, do you try to make yourself busy to avoid the reality? Or are there times when you feel that you can befriend the solitude within which many of us exist? Again, each one of us, to some extent, we have to make some sense of meaning for the purpose of our life. What is this? What does life mean? Do you ponder, who am I within this larger universe? And how do I make meaning so that I have the energy to face life, to get up and feel the energy that it takes to be alive? So I'll ask you to ponder, make a mental note. How do you make meaning of your life, and how do you see your purpose, especially in this very, very difficult time when all these issues are so challenged, or freedoms to do what, the reality of our isolation, the social, physical distancing that we have to do to be safe, the things that gave us meaning before, the connectivity we had, the things we did, the travels we took, so much of that is restricted. So how do we find new meaning? And finally, as we are now close to 300,000 people dead, as one of my favorite newscasters says, 300 souls, close to so many souls being lost. Whether we want to acknowledge it or not, we are really having to face the reality of our own mortality. Whereas in the past we didn't have to think about it that much, seeing and knowing other people, or just hearing about so many other people who have passed on. We are confronted with the reality of death. It's certain, because as you are born, so will you die. What is uncertain is the time. So then I ask you to reflect on, given this reality, how do you live? How do you find the energy to be present in each moment, so that whenever this will end, this experience of consciousness as we know it, so that at least there was a sense of I turned up and I lived. these are some of the big questions that I think this difficult period asks of us. And I find the more that we respond and think about these things, where we create some enough presence, enough solitude, that the more we think these things, the less anxious we will become. So, within the day-to-day experiences of our lives, for most of us, we are in the workplace, we have families, we live in a community. How do we tap into and learn how best to cope and how to be resilient, bouncing back and building back from all the challenges that we now face? Just as I said earlier, we are collective as a human species. They're the things we do, and because we're in the workplace, they're the things that can happen at work, and certainly we are depending on the society at large, our American brothers and sisters, to help us to do the right things. So we know that the CDC, that's supposed to keep us safe, they have created the guidelines. I will quickly run through them. Just a reminder, it's so easy. I find myself increasingly, as much as I wear my mask, is as difficult sometimes as it is to remember, put it on. So I find myself running back. You know, we're talking about the coronavirus fatigue. But we have to abide by those guidelines to make it through this hopefully last hurdle till there is good treatment and or a vaccine. So we need at the societal level for there to be reinforcement of the CDC safety guidelines. We know that for the 400 years, for certain groups, for African Americans, for Native people, for other ethnic groups, there have been the Latinx community, there have been health inequities. Given that our health is so threatened, again, we need society, we need to push for these inequities to be addressed. The access to COVID-19 protocols for all people, not just the privileged, but for those who are in need, access to the highest level of treatment if one becomes sick. We do know that in certain communities that access to treatment and testing is not as available. It's still based on privilege and not need. However, given the caring that this partnership is engaged in terms of the work at the multiple organizational level, I am hoping that access to the required personal protective equipment is present. There's the encouragement to have days off if one is fatigued, one is overwhelmed, and there's always the celebration of whatever little victories exist within the organizational space, and that there are more opportunities for workers in the same space to feel connected, to feel supported, and to be able to have a little bit more vulnerability. We need each other a little bit more. And you know, sometimes in the workplace, we have our boundaries up. There's but so much of our personal lives that we bring to the workplace. But sometimes in disasters, we have to feel safe enough to be able to share our vulnerabilities, to say, you know, on my way to work today, I got into the parking lot and I just felt extremely anxious, and I don't know why. These are the kind of relationships, more trusting relationships, that I think this pandemic is asking of us in the workplace. We need to be just a little bit more connected and feel that we can depend on each other just a little bit more than perhaps we did before the pandemic. And then what I'm going to focus on is at the individual level, what can we do to build our resilience, to make it through this and to make it through strong and better. And so I'm going to talk about managing some of the stress, prioritizing self-care, caring for ourselves, loving ourselves, being compassionate with ourselves. As I said earlier, finding meaning and purpose, a renewed sense and a zest for life in the face of it being so threatened. And then knowing the warning signs if we're not coping so well and we end up with some degree of mental distress, imbalance, and for some people that mental distress can also turn up in our physical being. So I'm just going to quickly reinforce here while we're together those guidelines about washing our hands, frequently using alcohol. I just read a medical article that says 80% alcohol, if we rub it for more than 18 seconds, will kill the virus if it's on our hands. So I would recommend going up to 80 versus 60% as the guidelines say. We want to avoid touching our face and mouth. Of course, we don't want to be in contact with people who are known sick, but in general, we want to have distance between ourselves and other people, at least 6 feet apart. The wisdom to stay home if we think we're not well, covering our faces, nose and mouth if we sneeze or cough, throwing these tissues away in the trash. All these things are important for us just to have physical safety. And if we know that we are doing individually, and of course wearing a mask, of course wearing a mask. And if we're doing these things, then knowing that we're doing the best we can to be physically safe, it really helps to manage our mental stress. And we are going to be mentally stressed because being stressed now is a normal response to an abnormal situation. And when there are threats to our survival, our emotions become heightened. We are more easily fearful, angry. For some of us, slightly paranoid because our survival is being threatened and the biologic responses in the body are being activated, or hypothalamus or the pituitary axis, where we respond to try to ward off invading pathogens or anything that threatens our existence. The lion in the jungle, that fight or flight response becomes a part of our survival arsenal. And to the extent that there's a virus, an invisible virus out there that's threatening our well-being and our lives, we're going to have a little more heightened emotionality. It's normal and actually it's protective. The issue, however, is not to avoid and deny that we are emotionally more heightened, but to know how to manage. And that's really where I want to focus on today. How do we manage this heightened emotionality? That is normal, a normal response to an abnormal situation. So I will quickly share what it is and go into a little more details. We have to know how to calm our bodies down. Our physical body is what reacts to our experience of our consciousness. It's our feeling place. And so we need to learn how when we're mentally anxious, we can manage, we experience that anxiousness in our bodies. And we have to learn how to manage and soothe and calm our body down. We also, to feel more safe, how do we enhance our feeling that if I do the right thing, I will make it through. And if we all are doing the right thing, we can make it through. As social beings, we need connection. We have a sense of who we are in relationship to others. That's significantly restricted and limited now. So how do we use other platforms to stay connected to each other? To feel more safe, we have to enact a sense, I'm not going to say optimism, blind optimism, but hope that in action, in doing the right things and in advocating for the right things, I'm hopeful that we will make this through. To feel more mentally safe, we are going to have to turn the mirror on ourselves, rediscover a more loving relationship with ourselves. Many of us become disconnected from ourselves, from truly loving and caring for ourselves as we kind of go on default through living our lives. And so how do we deepen our self-care? And ultimately, again, within the normalcy of the life that we live, many of us, I know many of you in the webinar are servant leaders. So how do you know when you're approaching burnout? How do you know that end state? How do you know when you're creeping into mental distress? So I'm going to start with self-care. It's a word that's thrown around a lot. It's become trivialized. But it is really, really significant to, at this point, begin to care deeply for ourselves, and as a result of that, we will care more deeply for each other. And so I like to define self-care as a journey towards a truer and more authentic self. We know that part of us, the usual conditioning or fears, as I say, some of it right now is very natural and is a survival mechanism, but outside of that, many of us, our usual life is around our impulses and our habits, and the piece that's the reality of deepening that sense of how do I get my needs met based on the reality of what exists. That's where we want to end up. And so to me, that is what self-care is. It's not about the things we do on the surface, the pampering. That's okay, but that's not self-care. Self-care is when we are being and living from the best space, the best way in which we know how to exist as human beings, get our needs met based on reality, and not suffer, and not in narcissism make others suffer. And so in self-care, we're returning to and embodying and living from that more true self. We are human beings that like to commune, but we also need that space for solitude. So that's what self-care requires of us, balancing that space of solitude with our communing with each other. Being a little more simple, we get a lot of kudos in this society for multitasking, but it's not good for us. The brain isn't wired to stay at that level of high intensity for too long. So how do we make our lives more simple? How do we have more presence? And again, how are we paying attention to how we're being versus the things that we do? The more we care for self is the more we open our heart space to ourselves, that we allow love to come to us. And then ultimately, living from that loving space, it becomes so much easier to give love to others. In self-care, as we're moving towards caring for self, we have to be more present to our current circumstances or reality. More mindfulness, practicing mindfulness. When we find ourselves getting lost in our thoughts, going back in the past, jumping into the future, just a practice of saying, I need to be, let me just focus. Let me feel my chest. Let me feel it get back to normal. Let me almost imagine the air going through my nasal passages, all the way through the bronchus into the lungs, bringing in the oxygen that we need to live. And usually in that space of mindfulness of breath, we also become more mindful of what's happening in our physical bodies. Those sensations are really what are telling us what is the reality of that our body is experiencing right now. And I'm going to encourage everyone to take just mindful breaks throughout the day. 1 minute, 30 seconds, 5 minutes, whatever you can, to just be aware of yourself in time and in space. And as we started earlier, accepting those givens in life that we all must face, issues around our freedom, the reality of our isolation, making meaning, and accepting that death ultimately is our reality. So I'd like for you to just reflect right now. I've talked about what I think and what I have seen self-care that really works, that creates equanimity, that creates ease. I've shared with you what I have seen work. I just want you to take a moment to reflect on what is your routine. Have you thought about how to care for and love yourself? Hopefully within a construct of a loving community and a society that is responsive to all or better responsive to all our needs. I just want to quickly go a little bit deeper into some of the things that I've mentioned earlier in terms of caring for our minds. You know, we spend so much time living on the surface, on the skin of life. And we sometimes need to carve out a little more time for reflection and to be a little bit more aware of what is the connection between the way I feel, because as I said, it is our feelings that give us our experience of consciousness. It happens in our body. So what's the connection between feelings, the positive feeling states, the negative feeling states? How do they impact how you think and then the actions that you take? This is self-awareness. Caring for the mind means increasingly being more self-aware. It also, as human beings, we cannot avoid suffering. We cannot avoid hurts. So caring for the mind means being willing to name where the hurts are, the pain that arises when there are losses and disappointment. It's by being present and naming them rather than avoiding and denial. It's by doing so that we can work with our mind and our bodies to figure out how to appropriately grieve, how to not suffer. Caring for mind, I challenge us, also requires much more time being contemplative, quieting our minds. So mindfulness and presence helps to do that. We can deepen that presence with contemplative practices, meditation, where we're just trying to quiet the thinking mind. And not that the thoughts are going to go away, but we're not going to put much energy into what the thoughts are telling us or requiring of us. We're just going to see them, notice them, and move on. I've been talking throughout the morning about mindfulness. It is so important. And what it does is the more presence we have in the reality of what exists right now, the easier it is when we're not just generalizing to figure out how do we move to the next moment. If we can tell right now in my body, this is what I'm feeling, I'm aware of my breath, it simply gives us a little more window, a little clearer window into how then do we move to the next minute, the next moment. And there's these other things we can do to care for our minds. We all have the capacity for imagination and creativity. Some are more gifted than each other. I tried picking up the piano during the pandemic, and it's like, no, let me listen to other people who are more talented. But we each have that part of us that creates, that is curious, that's imaginative. And part of mental hygiene is being more in tune and being more in focus with what some of that is. I've heard so many people during this period talk about, I've been doodling and I realized there is art inside of me. People are recognizing there is more song and dance and music. We each need that creativity to help to relax the mind from the tension of the stress that we are all dealing with. And let me highlight the need for play. Whatever that play is, we really need to play more. It reconnects us to some of the joy that we had in our earlier years. So whether we're playing cards, we're out in nature, we're engaging in games, we're doing trivia, whatever it is that just takes us out, again, out of that extra thinking mind and brings us a little bit closer to our innocence. In nature, I think we've all, at the beginning of the pandemic, so many more folks were talking about taking walks, being in the park, going to the mountain, going to the ocean, depending on where you are. Just being in the wondrousness and the magnificence and beauty of nature is so very soothing to our minds. I have been hyping journaling, making little notes, written notes. Some people don't like to write. So, mental noting of just what's happening in my mind. How are the feelings and the thoughts and actions connected? What are the stories happening right now in my life? And another soothing, caring part for some of us, the importance of the lineage, the ancestry from which we came, the wisdom that exists in who they were and what they left with us. These are all things that help to soothe our minds. I mentioned earlier the things we need to do to keep our bodies safe. We cannot experience life without our physical bodies. So we have to care for it. We can't just take it for granted. And one of the best ways to care for our bodies is to pay attention to what we're putting into it. I don't need to tell you what the science says, about the foods that are healthy and the foods that are not. I know there are some social economic factors that impact some people's ability to access healthier foods, but sometimes also within that, we grow up with some preferences. It appears, unfortunately, that the things that most of us love the most, high fat, high sugar, they're really not that good for us, nor is animal flesh. And so we know the healthier diets are more plant-based, less fats, less sugar, and hopefully not too much genetically modified foods. And then the way we move our bodies, the way we connect movement with breath, that can be achieved through activities like yoga, Tai Chi, Zumba, drumming, dancing. All these things help to focus in on the physical body, to connect it to the breath, to move it. The body needs to move. This is part of how we care for ourselves. Because without this physical body, there is nothing. There will be no experience of this conscious life as we know it. And for some people, the sense of essence and spirit, soul, whatever it is, that mystery, what connects us to the life source, it's different for each person. That there's a way in which we nurture that, and depending on how we experience ourselves in that mystery is the way in which we pay attention to the nurturance of that space. And I want to end a little bit on knowing that so many of you, myself included, a large part of who we are is caring for others. So how do we balance what our needs are in terms of the way in which we care for others? And one old adage I find I've heard all along, and I know is true, is that by being first at home in ourselves, caring for ourselves, loving ourselves, is how we can best be at home with others. There is, as we serve and care for others, there's a tendency for many of us to do too much. And I love the way in which this Buddhist priest Roshi Joan Halifax talks about ed states. We're based on the high level of caring for, connecting, and just our good virtue about others. We slip from our own health into pathology because we're not caring for ourselves. We've lost the balance. And Roshi Joan talks about empathic sliding, where the true good empathy it becomes empathic distress because we're taking on too much of someone's suffering. And by taking on so much of it, we become damaged or paralyzed. I like to say, in terms of we put our foot in someone else's shoe to have a sense of what they're experiencing. But if we're to help them, we cannot wear their shoe. We have to take our foot out when we have slipped on the shoe that of their burden to sense and figure out how best to help them. We have to pull back and care for ourselves so that we don't get in that lane of suffering with them. They need us to be well, those we're caring for. Because if we get to that space of overwork, of empathic distress, of compassion, fatigue, then we begin to approach burnout, disconnection, and we can actually take on mental illnesses, trauma-based mental disorders. So I'd like for you to reflect on, make a mental note or slip something into your journal. What is your ed state? How do you know when you have slipped too far from the goodness of helping someone, helping them manage their own needs, their own suffering, that you now are beginning to suffer along with them? What happens in your body? What happens in your mind? It's really important that when you're in service, you know what your ed state is so that you can pull back. Because if you don't pull back, you're going to slip over the cliff with them. And develop these, as I said, these secondary traumatic stress conditions like PTSD. And I'm not going to spend much time there unless there is someone in the audience who wants me to go much deeper, but that's where your memory is impaired by the trauma of the work you're doing. You're having flashbacks, you're avoiding, you find yourself not wanting to go to work, you're feeling badly, you're having bad thoughts, and you're a little bit more hyper-aroused than you should be at this period in time. And always going along with this slipping over the edge, secondary traumatic stress is usually depression, where you're feeling depressed, down in the dumps most of the day. The things that brought you pleasure are not so pleasurable anymore, the things you used to do. Your weight is changing. You're having sleep problems. You find yourself a little more agitated or slowed down. Your energy changes. You're feeling guilty. You're worrying. You're not able to think. And then, unfortunately, for some people, there is the will to live, the meaning of life begins to diminish. And there may be thoughts of wanting to die or wanting to take one's life. That's depression. We don't want to get here with our work. Also, there's enough about the pandemic to make us anxious. We do not want to take on an anxiety disorder where we're panicking. We find ourselves getting markedly anxious going out in public. We also are just generally feeling more tension because I said we feel in our bodies, so we're restless, we can't concentrate, we're irritable, our muscle is tense, we're having GI problems, our heart are beating fast. These are all symptoms of anxiety disorders that if we're not caring for ourselves, if we're not paying attention to our ed state, that we can slip into. We don't want that to happen. So I know that some of the things I mentioned, we're in workplaces, some of the things that we can do to help to support ourselves and each other is being a little bit more connected in that workspace, finding ways to have more peer support, to be a little bit more vulnerable. I said that earlier. If we need a little more supervision and consultation, because we're all a little more tender, to seek that out, the areas we need training to make sure that that's happening. And if we need to engage in therapy, therapy is a beautiful thing. It's when someone else has to hopefully create a safe space for us to be able to reflect on. That person is going to help to facilitate our journey into understanding ourselves a little bit better. And things that can happen also is going back to the ed states, setting those limits and boundaries and having at the organizational level attention being paid to that. So just think as we come to a close, how do you avoid burnout? And I encourage you at the start of that to think about what is that ed state. How do you know you're slipping over? And then what do you do to care for yourself? And I want to end with one of my favorite poems, really the invitation to do and think about, and I shouldn't say do, to be in the space that I've encouraged us throughout these past minutes. I've been with you and this is a poem by Derek Walter. It's Love After Love. It's an invitation to come home to yourself in a loving way. And it goes, the time will come when, with elation, you will greet yourself arriving at your own door, in your own mirror. And each will smile at the others, welcome and say, sit here, eat. You will love again the stranger who was yourself. Give wine, give bread, give back your heart to itself, to the stranger who has loved you all your life, but whom you ignored for another, but who knows you by heart. Take down the love letters from the bookshelf, the photographs, the desperate notes. Peel your own image from the mirror. Sit, feast on your life. And that is my wish and my hope for us all, that we will sit, feast on our lives in a loving way, and in so doing, move to that ethical space that I know we are all here, where we come with, where we care for each other and we care to make each other safer and saner and well. Thank you all very much. And I'm sorry if I went a little bit over, but I do think there's some time for some questions.
Yes, Mr. Rington, this is Lana Show, co-director of the Partnership Cares Project. We do have some time for questions, so if anyone has a question, if you'd like to put it in the chat, we will take that opportunity to tap into the wisdom of our speaker and get some further guidance in reference to your question. Early on in the chat, one of our participants posted how much they appreciated and stay sane. Sometimes that does seem pretty hard in our current reality, but keeping that in our consciousness, that's the goal. It's not only to stay sane, but to take care of ourselves is important in our preparation to do the kind of work that we do. A couple of things that I found very interesting was your statement about the responsibility to care for each other and how this is a societal issue, not only a personal or an organizational issue. So can you tell us just a little bit more about that? What, in terms of societal issue, can we have happen that makes it possible for us to care for each other?
Mm-hmm. And, you know, this comes from indigenous wisdom in that we live best when there's collectivity, and we have a responsibility to each other in the communities in which we live, and as those move out, get larger, to the society at large, and I would like to say maybe to the world at large, and maybe to the earth, where we get our sustenance, and that the more we live in that space versus what I think has been somewhat twisted in our constructs of free individual rights and freedoms. I don't think as human beings, as a human society, if we all did exactly what we all wanted to do, and in particular if we become so narcissistic, then we care only for ourselves and we don't care for the other person. And if you think about the societies that have done well during the pandemic are the ones that care about each other, and so they do the things. They don't have any issues wearing masks. You know, New Zealand, look at New Zealand. A large part of New Zealand is that indigenous population, and I'm pretty sure that some of that wisdom came from that. I have to care about you sufficiently to know that even though it's a little bit uncomfortable and sometimes fatiguing to wear the mask, if I do that just in case I have the virus, I'm going to protect you. And if we do that, then we would be protecting each other. In the same way I wear my mask because I want to protect myself, I do that from a space of wanting to protect you. I do not want you to die. And I don't want to die. I know you don't want to die. So can we care for each other? And I think we're going to have to go back. I'm hoping, as we think about how have we been changed, what has the pandemic taught us, what are we going to take from this, I am hoping that we will take more collectivity and more love for each other, caring for the well-being of others.
Right. Thank you. And to go full circle, caring for each other is part of the promise of community action. So it is deeply embedded in our work and our purpose in doing what we do and helping people help themselves and each other. So I loved that connection to our promise. We have a couple of questions in the chat. Can you tell us who wrote the poem?
Yes, it is. I just had a brain freeze. It will come back. I cannot believe I did that. It is. Oh gosh, it will come. I know I will remember it before.
We'll go to a couple of other questions and come back to it.
Yeah.
With the limited time that agencies have available, do you have any recommendations of what we can do to support our staff in taking time for themselves?
Yes, I have, I've been in some other, Derek Walcott, I'm sorry, that's the name of the poet.
Very good.
Yes, Derek Walcott.
Thank you.
Yes. I've been in several workspaces, and one thing I have heard, after having these conversations, that the leadership encourages people to take vacation. It's like, because a lot of people weirdly, especially those who are working from home, and it seems like you're kind of home, they're not taking as many vacation. This one organization, they said they noticed that less people were asking for time off. So leadership was actually encouraging time off. And perhaps leadership also needs to model that. We're all, I don't want us to panic, but these are some really difficult times. And I think we increasingly need a little more space to be in the circles where we're safe and we feel loved, and also where we can recharge. So I think we're just going to have to make that part of the work culture, is encouraging each other. You seemed stressed yesterday. How can the organization support you taking some time off? And sometimes the person might not have some time off. We're going to have to be a little more generous. Take 3 hours. It's not going to, because if that person is at work fatigued anyway, their productivity is going to be down. And how much more grateful they will feel if the workplace says, just take 3 hours. We're not going to time clock this. Just take a breath, go do something that recharges you. We're going to have to do a little bit more of that. Now, I know that there's some workspaces where there's customer service and you need coverage, but those things can be worked out. People have gotten very, very creative in how they can do a little bit better supporting each other at work.
Great. One more question. Do you have ideas on how to reach out to each other, especially those who maybe don't necessarily practice self-care? What are some good approaches we can use with that segment of our staff who just aren't that engaged in self-care work?
I think it starts with, these things always happen in conversation. What's happening, what's going on. Because as I say, self-care is really about loving oneself, having a certain attitude about who we are, to value and care for the well-being of ourselves. say some people, it's out on the surface. It's like I get my nails done, my hair did, I go for a massage. That's all very good. But in terms of self-care, where there's balance between mind and body, we're gonna have to encourage a little more deepening of our interest in knowing ourselves, because it's from knowing ourselves that we know how to care for ourselves. One of the things I say to folks, I don't do toolboxes, because what someone needs for their self-care, it's very individualized, and you know what you need based on knowing yourself. Self-care is about knowing self, to know what one needs to be able to be living a life in which one can create more ease. It's the loving kindness meditation, metta meditation. May I be happy. May I be safe. May I be healthy. May I live with ease. That's self-care. And the way to know how those may I's happen is by knowing self better. And so encouraging, whatever the actions need to be in the workplace, to encourage that. Encourage more conversations. I've heard a lot of people say they're just creating opportunities in the workspace for people to have like 30 minutes to just talk. I heard a vice president of an organization say, by just doing that, she began to learn how many people on her staff had lost people due to COVID. They never before had space to just have conversation. And it was like, wow, you need some time off. You've had 7 people die in 3 months. But how would she know? How would management or leadership know unless they created space for connection and for true conversation?
Interesting. The importance of listening in what your colleagues are saying and giving them your active listening skills is helpful to them and helpful to you as a coworker in identifying what it is they might need and following up with questions and statements of care and concern. Great.
Someone mentioned working from home and the healthy boundaries. Yeah, I find myself slipping also. So I'm in that number. And, I find that sometimes I just have to do what I know is right, is to have that moment of mindfulness and say, I'm approaching my ed state. My body is tense. I'm at the computer and I need to get up and I need to go. I need to take a walk. I think we feel that, we're at home. This is, we're not really, really working, even though we're working 2 times as hard. And, because I'm home is a kind of staycation. No, it's not. It's a workcation. And so I think we have to be very mindful of when we are approaching that. So whomever put that in the chat, I'm right there with you.
Yeah.
And there's a question about toxic work cultures and unrealistic expectations. And toxic work cultures come from toxic people and toxic leadership. So how do we improve upon that? I really think that it is not wise. The CDC asks us if we're sick to stay home. So the idea that leaders are going to work sick with the virus is not good. There needs to be some accountability, and maybe that leader felt that. So again, they don't know their ed state. I mean, they feel that they must turn up or things will collapse. Well, maybe they will collapse, and so I'm pretty sure that the motivation was probably well-meaning, but it's not the right thing. It's going to put other people's health at risk. And most importantly, to get through COVID, you need to rest.
Great. All right, I think that's the last of the questions. We want to go to the next few slides. We do have another training coming up related to the work environment. It's being done by Beth Reynolds Lewis and Kay Glidden, who are co-owners of Compassion Resiliency. It's staying well while working in high-stress traumatic environments. This first one will be held on December 11th from 12 to 1:30 Eastern Time. This particular training is focused on supervisors and things that can be done within the organization to help deal with stress and trauma. We will be following up with another webinar training from Beth and Kay that will be open to all staff of community action agencies, but we wanted to do the supervisors training prior to doing the training for all staff. So this information will be coming out in more detail on the next e-news, and we'll also be promoting the staff training as well. In addition to this, we have our Management and Leadership Training Conference coming up in February, virtual of course. It will be the 3rd through the 5th. Arlene and I will be doing some workshops on the CARES initiative that we're working on with the partnership. But in addition to that, we have lots of other workshops that will be valuable to our member agencies and their staff. And the last slide has the contact information for Arlene and myself, as well as Erin, who is our team leader. And I just wanted to close with one other thing that Dr. Sivington said that I think is closely connected to community action in our work, and that is the practice of hope in action. And that is what we do. That's what we do every day with the families that we work with our teammates, and hopefully in our advocacy efforts to the world beyond our community action network. So again, thank you, Denise Servington. We very much appreciate your wisdom, your intellect, and sharing with us how we care for ourselves so that we can care for others. Much appreciate you doing the webinar today.
Thank you very much. Okay.
Bye-bye. Thank you. Yes, and all of you, self-care, don't forget. And thanks to Courtney and Amy, who helped facilitate the technology side of things. We just want to express our appreciation to the partnership staff for their work on the back end. We much appreciate that as well. So thank you, everyone.
Bye-bye.